walking, running, playing tennis, or playing golf can be extremely problematic, especially if you're suffering from joint pain. Well, that was the case for Stephen Hayes. He was suffering from joint pain until he found NeoGenix. 14 years, right? 14 years you're suffering with this pain. How bad did it get, sir?
That's right, Eugene. I was told that I would need surgery on my right shoulder, and that on my left shoulder I would need steroid injections and physical therapy. I reached a point where I really couldn't even sleep at night. It didn't matter which way I turned. There was pain, so it would wake me up constantly. That was the single biggest problem, is no sleep.
So Steve, you turned to normal injection, normal treatment that pretty much did not work for you. Can you tell us about it?
Yeah, the steroid injections would last for a limited amount of time, and the pain would always come back. So it was either continue with ongoing injections, or you would reach a point where you would be in need of surgery. So I didn't want to do either one of those, frankly, and was looking for an alternative.
You find NeoGenix. How did that happen?
Well, I had known Dr. Altizer for years, and he's an expert in the field, and probably the single most experienced physician in the area when it comes to stem cell injections. So that was an easy decision for me because I knew the right guy to go to.
We are joined by the medical director, Dr. James Altizer with NeoGenix. And Doc, tell me about stem cell therapy and why is that so successful?
Well, all the previous treatments we've had for arthritis just covered up the pain. Cortisone shots, gel shots, they don't do anything to treat the tissue damage. Stem cell therapy is the first treatment we've ever had that can actually reverse the damaged tissue inside a joint caused by wear and tear. It's going to revolutionize the treatment of arthritis.
So what type of conditions are we talking about with joint pain?
Well, large joints. Hips, knees, ankles, shoulders. I can do small joints, thumbs, wrists, carpal tunnel, plantar fasciitis or heel spurs. We can even do low back pain. About half the cases I do are people with pain in the low back, and the results are phenomenal.
So let's dig into some of the details. You have a 5-step protocol. What is that protocol and how does that meet the need of the patient?
The first step is preparing the joint for stem cell therapy. An arthritic joint is very inflamed, so we do an injection first to calm down that inflammation to make the joint more hospitable for the stem cell injection, which is step 2. Step 3 is using bracing, either a back brace or a knee brace, depending on what type of joint you have injected. Step 4 is physical therapy. They've done studies, Eugene, to prove that combining physical therapy with stem cells gives you a better result and gets you pain-free even more quickly. And the 5th step is a booster shot of PRP, which is growth factors, 6 weeks after the stem cell injection. And after 4.5 years of doing this, I've discovered that this gets people back to being pain-free and gives them their lives back quicker than anything else I've ever done.
And just quickly, just about some of the results that you just tried to touch on, we see the results may vary a little bit.
Over 90% of patients that I treat have a significant improvement in pain and function and can get back to living the lives they want to lead. The results are really phenomenal.
So Steve, how has this changed your life?
Well, I can sleep now. I get a full night's sleep without pain in either shoulder. But most importantly, I can play golf again, Eugene, and that's a big deal for me. Not that I was a great golfer, but I sure loved it. And I tore this rotator cuff in a tournament a year and a half ago. And so I'm now able to go out there with a full free swing, and I don't have any pain at all in my right shoulder and almost no pain at all in my left shoulder.
So Steve, you're feeling better, you're feeling good. What would you say to somebody who's watching right now? What would you say to them about stem cell therapy?
I would say that you have to give it a chance. And I think that if you are a person who would like to avoid surgery, you would have to give stem cells a chance. I believe that it's right on the cusp of becoming a breakthrough treatment that you're going to see worldwide when it comes to treating these types of injuries. I think it's that significant, and I think it works that well.
Well, call NeoGenix for a free consultation to see if you are a good candidate for stem cell therapy. The consultation can be virtual or in office. The number is 704-727-6551. That's 704-727-6551. Or you can reach them online at neogenixstemcells.com.